What to do after a possible HIV exposure. Understanding PEP. You just had sex, and now you've learned that your partner may be HIV positive. It's okay to feel worried, but before panic sets in, take a deep breath. There's help available, and it's called PEP. PEP stands for post-exposure prophylaxis. It's a short course of HIV medication taken after a possible exposure, and when taken correctly, it can greatly reduce your chances of becoming infected with HIV. But here's the key. PEP must be started within 72 hours. That's 3 days after the possible exposure. The sooner, the better. PEP is usually taken once or twice a day for 28 days. It's safe, it's effective, and it's used worldwide by people who may have been exposed to HIV through unprotected sex, a broken condom, or other high-risk situations. If you think you've been exposed, don't wait. Go to a hospital, a sexual health clinic, or speak to a healthcare provider immediately. They'll assess the risk, test you, and help you start PEP if it's appropriate. Betting taking PEP is not a sign of failure. It's a smart, proactive step toward protecting your health. And no, one possible exposure does not mean you're now HIV positive. PEP exists to prevent that. So don't panic. Don't freeze. You have options. You have time. But act fast. PEP works. HIV is preventable. You are in control.